Hello, my name is Dr. Irvin Sani with the Spine Center of Texas, and I'd like to talk to you about external bone stimulation. If you're watching this video, it's because you either already have or you're getting ready to have a spinal fusion surgery. Although external bone stimulation can be used for long bone fractures as well, primarily what we do in our practice is back surgery and spinal fusions. External bone stimulation is an excellent way to minimize the chance of having a complication called a pseudoarthrosis or a non-union, which simply means that the bones failed to grow together, and maximize your chances of your bones healing so that you don't have to have a second or even a third surgery. The indications for this are diabetes, multiple levels, patients who smoke, etc. In other words, people who are at risk. For example, a 30-year-old or a 40-year-old non-smoker, non-diabetic, having a single level anterior cervical decompression infusion probably doesn't need to have an external bone stimulator. However, a person who's having multiple levels, smokes cigarettes, is a diabetic, or is on steroids, oral steroids, is at risk for not having their bones grow together. The external bone stimulator simply works by sending out either ultrasound waves or magnetic radiation and stimulates the cells in your body that produce bone. They're called osteoblasts. Osteoblasts build bone, osteoclasts break down bone. And by stimulating these cells that build bone, we simply increase the chances, although we don't guarantee them, we increase the chances that you will have a solid fusion and not require further surgery. My reoperation rate due to non-union and pseudoarthrosis is extremely low. And although I'd like to think it's because I have great technique, I also have to believe that it's because I've consistently used external bone stimulators in my patients who pose a risk for having this complication, that is, not healing properly. And it is important to wear the external bone stimulator. One of the biggest problems with external bone stimulators, is non-compliance. That simply means the patient doesn't feel like wearing it and just simply doesn't use it. An external bone stimulator will not work if you don't wear it, just like your diabetic medication will not work if you don't take it. So it's important to use the external bone stimulator as directed, and also understand that there is an internal computer that we can retrieve the data to see how much the stimulator has been used or not used. Most of the time, we start the external bone stimulation about 2 weeks after the surgery. And depending on the exact product, you can use this external bone stimulator for up to 9 months after the surgery. This also gives us time to get some good post-op x-rays and be certain that you are obtaining an excellent fusion. For people who are even higher risk, extreme smokers, extreme diabetics, or people with other extreme risk factors, they might even have to wear their external bone stimulator longer. The external bone stimulator can be worn anywhere from a few hours a day to less than 1 hour a day, depending on the particular device. There really are no complications associated with an external bone stimulator. In other words, it's not going to burn your skin, it's not going to give you a headache, it's not going to cause you to have some sort of metabolic disorder. The problem with an external bone stimulator is, again, most of the time non-compliance, not using the device, or even when you use the device, for some unfortunate individuals, it may not be very effective, and they still could go on to develop a non-union or a non-healing fusion. So in summary, external bone stimulators are a wonderful device that can prevent reoperation. We will determine whether you are a candidate and whether an external bone stimulator is indicated.